All right, everyone. I think we will go ahead and get started. Thank you all for joining us today. It looks like we have really great attendance. If you can hear me, can you just give me a little thumbs up? Because I know some people were saying they couldn't hear, but we hadn't quite started yet. Okay, perfect. Thanks so much. Thank you all for joining today. I'll go ahead and hand it over to Lisa, and she will do a brief introduction.
Hi, y'all. Oops, sorry. Uh, today we are delighted, excuse me. Today we're delighted to have um, Kara and Andrea with us from It's Time, Texas. Kara is the Vice President of Impact for It's Time, Texas, and they are a nonprofit connecting a healthier Texas through focus on health prevention. Kara is a purpose-driven leader, connector, project manager, and strategist with over a decade of experience in leading organizations to achieve measurable successes. She has a proven track record for design and funding of innovation and award-winning programs that have impacted more than 1 million Texans. Kara got her start volunteering with food pantries, which led to becoming an advocate for equitable food access and policy change. She serves in leadership roles on several statewide and regional health coalitions, including Live Smart Texas, Partnership for Healthy Texas, and the Michael Susan Dell Center for Healthy Living Advisory Committee, and Unidos contra la Diabetes. Sorry about my lack of Spanish there. And then Andrea is the Senior Director of Health and Civic Education for It's Time Texas. With more than 15 years of experience in public health, her work spans health curricula creation, program development, management, and advocacy. At It's Time Texas, Andrea oversees the development of community-informed and evidence-based health and civic education programs, ensuring they impact Texans' health in meaningful ways. A social and reproductive justice advocate, Andrea serves on the board of Healthy Literacy Texas and Healing Hands Community Doula Project. And I'm going to turn it over to them. Thank you so much for being here, you guys.
Yeah, Lisa and Shelby, thank y'all so much. We're so excited to have our first of 3 webinars with SOPHE. I was able to attend the conference last fall and just met so many great people and really excited to engage with all of you. If you're a member, if you're not a member. Before we go ahead and get started, I know it's post lunchtime. Hopefully everyone's kind of finished up eating. If you're able to turn your camera on, that would be wonderful. I do want to take a quick photo of us. If you do not want to be on social media, turn that camera back off. But if you want to be, I want to see all your smiling faces. I want to show people our energy today to talk about health literacy. I see some familiar faces. Hello, hello. All right, I'll give y'all a couple more, maybe 10 more seconds, and then we'll take a group photo. It's like when the award host, like takes a selfie. Um, okay. Oh my gosh, everyone looks amazing. All right. Okay, so feel free to smile. You can do whatever you want with your hands. So 3, 2, 1. Awesome. Thank you. You just helped me with our marketing team. So thank you, thank you, thank you. All right. So let's head into our discussion today. It's going to be interactive. It's going to be fun. And guess what? It's about health literacy. That's why we all showed up here today. So first, before we go ahead and get started, if everyone in the chat can tell me your name, if you are a part of an organization or affiliated with an organization or academic institution, and then what city are you joining us from? And Paige is helping me out in the chat today. Paige is from It's Time, Texas, so thank you to Paige. Okay, okay. NYC, okay. Austin, Phoenix, okay. All right, well, this is national. I love this. Oh, wow. Okay. A lot of out of Texas. Okay. I love this. Okay. Well, Leanne, please come to Austin. We'd love to have you here. It's very warm right now. So let you know that. All right, well, let's go ahead and get started. So just a reminder, we are funded by SNAP-Ed. So just sharing with you our And Justice for All information, if there's any civil rights concerns today. And I'm going to move on. So today I am Kara Hanaoka. I'm the Vice President of Impact. I've been with It's Time Texas for about 6 years. You've heard a lot about my bio, but very passionate about health literacy and increasing access to health for all Texans. And I am joined by Andrea Rosario, my amazing colleague and huge advocate for health literacy. And you're going to hear her talk a lot about this work. And she actually, the entire time at It's Time Texas, has been working on the program that we'll be talking about today. Okay, I'm going to go to the next slide. So a little bit about It's Time Texas. Hopefully a lot of you are familiar with us through our Healthier Texas Summit, our Community Challenge, some of our policy systems and environmental change work. We are a statewide nonprofit working to bring people, organizations, and communities together to take action that supports health for all, now and for generations to come. We believe deeply that where you live should not determine how long you live. So many of us that work in public health know, depending on your zip code within your city, your life expectancy can vary greatly, and we want to change that. And a big part of that is health literacy. So we'll be discussing that today. How is it important to our communities? How can we be advocates for increasing health literacy, and some programs and some evidence behind those programs? Okay, so our learning objectives, we always have learning objectives as public health professionals. So today we're going to define and identify the components of health literacy. So you'll be able to step away and have a really good understanding. Then we'll evaluate the role of our telehealth coaching and exercise and nutrition classes. So those are two interventions that It's Time Texas does in the community that work to enhance health literacy for adults. And then we're going to comprehend the direct service model and that evidence-based impact. So we'll talk a little bit about our evaluation that we do in partnership with UT School of Public Health. And I know we got some UT School of Public Health people on the call today. Okay, so we're going to start with a little bit of self-reflection, and then we're going to do some breakouts before we get in kind of the meat of the presentation. So for the next 5 minutes, we're going to take some time to answer these questions. You can either type your answers in a Word document, you can grab a journal or piece of paper, do paper and pen, old school style, but we're going to take 5 minutes to reflect on these questions. If you have your camera on and you want to turn it off, you can. I see most people are hiding again, but we're going to take the next 5 minutes and take some time to reflect on these questions. All right, y'all. I will see y'all in 5 minutes at about 2:19. I did see someone's message in the chat to put the questions up. Yes, Andrea's about to put them up. We're just waiting. Sorry, there was some technical difficulties on my Mac. It was rejecting. Thanks, Andrea. All right, time is up. Thank you, Andrea, with the timer. I love Zoom features. All right, y'all. So we are going to go into our breakout rooms. And what we're going to be doing is in groups of 3, we're going to be sharing with each other what were our answers to these questions. So thank you so much, Paige, for putting that in the chat. So you'll have those questions as you go into your breakout room. So Andrea is going to send everyone to their breakout rooms. If you're still in here, try to head to your breakout room just so we make sure those are even. right, time is up. Oh, people are going to get a little bit of time to come back in. Here we go. They're trickling back in. So if you just joined us, I know some people popped up during the breakout sessions. If you just joined us, we had time to self-reflect on these 3 questions. And then we went into breakout rooms with groups of 2 or 3, depending on who ended up in the breakout rooms, and we were able to discuss those questions. So let's do a little reflection about what we know, what we're coming here with today. And is anyone brave enough to share how did their group define health literacy? You can either take yourself off mute or you can put it in the chat. Who wants to be brave to share?
Can you hear me?
Yes, we can.
I had a hard time getting into that break room. I was in break room 18 and nobody showed up. And anyway, I would like to share if
Yeah,
you
we would love that. Thank you so much.
okay. So the first thing I was thinking, because it initially I kind of got stumped, and then I thought about skills. And then I was thinking you need to have the ability to read in the language that the information is being communicated in if you want to upgrade your health literacy skills. I was thinking you need resources in order to access health. So you need to be skilled in finding resources that will upgrade your health on a personal level. And then when I thought about organizations, I was thinking about their employees. And most organizations have employees, and so you want them to be able to be productive. And so you need to have insurance in place for health, and you need to have other resources, a program to increase your employees' health literacy or the people in the organization.
Absolutely. Yeah, so I heard written health literacy, being able to understand written information, or being able to understand and have access to resources, and then kind of at an organizational level, making sure your employees have that. Yeah, thank you so much. And what was your name?
Nafifa Nayamka, and I don't think it's up there, but that's my
Yeah,
name.
thank you for being here today.
You're welcome.
Maureen put in the chat, health literacy is the degree to which individuals have the ability to find, understand, and use information and services, so very similar, to inform health-related decisions and actions for themselves and or others. I have seen that definition too, so we may have something similar in just a second. What about the second question? What skills? What did groups talk about? Any key skills that came up? Unmute yourself or put them in the chat. Okay, critical thinking. I love that. Other skills. Cultural competence and empathy. Yes. Communication skills. Thank you, Isabel, Maureen. Great communication skills and active listening. Awesome. And then the last question. So this is kind of a newer thing for people to think about. How would you all differentiate between personal and organizational health literacy? So what came up in your conversations? What's one of the big differences between those? See a lot of
Hello,
skill teach back.
this is
Yes, go ahead.
Tiffany.
Yeah.
One of the things that was brought up in our room is, oh goodness, now it's just escaped me. Joy was in a room with me. Well, like for personal, it's going to the doctor's office and being able, someone with a healthcare background can speak certain medical terms and we can understand each other. But if it was me in a healthcare role with a patient, that is not the same level of health literacy.
Yeah. So different roles. Thank you, Tiffany. It looks like there is some things in the chat, judging from the terms, the differences in the scale. So kind of similar to what Tiffany said. Personal health literacy is pertaining to your own choices and how they affect you. Organizational health literacy is pertaining to the collective choices and how they affect collective health. What decisions are being made to make things easy or hard to navigate. Someone in the chat said personal is what's important to you, and organizational health literacy is what is important to the community. Lori said how you teach patients and address needs and the efforts of focus led by the organization's initiatives. And then on a personal level, one needs to accommodate the uniqueness of health issues. Yes, very individual. And then organizational is more good for the broader community. All right, well, I love all of the feedback. So let's go to the next slide and see what is kind of some universal definitions. So that's what we came here today, kind of knowing from our own experiences, and what are some common definitions. So personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So a lot of what was said, really having that ability to be able to read that written communication, to be able to read, to understand health information and gather those resources. Organizational health literacy, which we'll talk about at the end of the presentation more, is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So very much what Ronald was saying in the chat, it's really a difference of scale. It's where really you fall into the health literacy movement. And so organizations are more responsible for it being able to enable those individuals. Next slide, Andrea. Okay, so health literacy breakdown, it's a person's ability to use health information rather than just to understand it. It's a provider's capacity to communicate clearly, educate about health, and empower their patients. And then a system's capacity to easily be assessed, navigated, and understandable by all. So we know there's a lot of barriers to this. So this is what we're trying to move towards. Next slide, Andrea. So why does this matter? Why are we here to talk about this today? People with limited health literacy, and if you think about the US right now, about 88% of people do not have high health literacy. And so 88% of people are really struggling in this area, and we're looking to improve their health literacy. So they're more likely to have chronic conditions that they can't manage effectively. They have less knowledge on their health conditions. They're not utilizing preventative services. They're being admitted to hospitals or emergency rooms for preventable reasons. They report their health condition as poor, and they have higher healthcare costs. So that's really why we're here today. We want to be able to remove those barriers for people. Andrea is going to talk a little bit about what that looks like in different parts of the state and how different communities have different barriers and some of the solutions that we have created here, and then the evaluation. So I'm going to let Andrea take it over now.
Thank you. And thank you very much for so eloquently describing health literacy for us and the educators here in the room. And with that, I'm here to talk about, yes, the barriers and also it's time Texas's part in increasing, enhancing health literacy throughout the state, and even how we reflect on our own organizational health literacy. And so we are focusing today on our telehealth coaching and our nutrition classes or education piece that we provide to folks all around the state. And so here at It's Time Texas, our telehealth coaching started in about 2017 with the goal of supporting Texans in creating and maintaining healthy habits to reduce the incidence of chronic disease. And so we provide services to anyone living in the state of Texas, 18 years and over, and we provide these coaching sessions, in English and Spanish. One thing to note, I definitely like to note, is that we do only provide them in English and Spanish. And so part of that health literacy is really assessing our opportunities to provide coaching in other languages. So really evaluating our language access here at It's Time Texas. And because it doesn't stay at just the coaching level, we really want to be intentional on how we provide these services, so that more Texans are able to participate in health coaching. And it's another great aspect of our coaching program is that we are able to use different technology features. So outside of the phone, we are also able to provide coaching services, text education through text messages and video. And so this also has the ability to enhance a person's digital literacy, as we are providing step-by-step instruction and continued follow-up to ensure understanding of those systems. When it comes to our coaches are certified community health workers who have training in various health focused modalities, and to support the participants in their health journey. So we provide, and they are also trained in motivational interviewing. They're all diabetes paraprofessional level 2 certified. They're educated in healthy eating habits. And one thing that was really important to us because of the type of coaching we provide, which is over the phone, is to be able to provide our coaches with mental health first aid and suicide prevention. We know that there is a level of or risk of depression or managing chronic diseases. And so we wanted to be able to make sure that our coaches were prepared and trained in certain preventative services so that they're able to identify that and then provide those resources accordingly. And when it comes to motivational interviewing, I'm sure here I'm in a room full of health educators. We all know what motivational interviewing is. And so we use that really as our tool to elicit the buy-in of our participants and understand where they are in their health journey. This allows them to be in control of that journey. And it also allows the coaches to understand how to provide the health education and the support that a person needs in getting to their goals. Another thing to note here is that we do not provide medical advice. So when we talk about being certified in diabetes as paraprofessional too, it's really to understand that disease state. And so when we are providing that support in disease management, it's really to make sure that the person then also understands where they're at. So our coaches are able to really dissect a provider's recommendations or requirements in some cases and break them down into smaller health goals for a participant so that they're easily achievable. And so we're also then able to guide the participant through their journey. And it's a really exciting health journey. And in a moment, I will take you through that. There we go. And so when a person enters health coaching, they meet with their coach, they're able to understand what the program is, they go through the registration process, and then they're able to go through this motivational interviewing and make SMART goals for themselves. Through that, we're able to then provide that health education and those resources. This is where those coaches are practicing the health literacy or exhibiting those health literacy practices. So we're able to provide teach back so that we're able to then assess how we're explaining health information to a participant. Exactly as we mentioned in the definition of health literacy, it's how a person is able to understand and then use. So we're of the information that they're being told. So then we're able to assess how we're explaining it to ensure that a person can use that information effectively. And then also using very clear, plain language. So again, we're not medical professionals here at It's Time Texas. And so making sure the materials that we're using is understandable and it's at a literacy level that a person can clearly understand. It's very plain text. If there's materials that we're sharing with them, ensuring that, oh, hold on one second. Ensuring that it's in a way that is very understandable. It's not cluttered. We provide cluster information, so very short, very burst information, and then go back to that teach back and make sure that a participant understands the information that we are providing. And then along the way, we're able to then update the goals. And so understanding what success looks like to a participant, and if there are some setbacks, instead of thinking of it as a failure, right? When we're going through a health journey and maybe there is a goal we just didn't meet, we think of it as a failure. So instead of thinking of it as a failure, thinking of it as a little bit of a setback and understanding what were the challenges, what can we change, so that a person feels, again, very involved in their goal setting and can feel successful along the way. And so in our telehealth coaching program and in It's Time Texas in general, we have a number of different partners that we work with, one in order to serve their participants, but also in providing support and understanding the participants that we're also serving. So we partner with many federally qualified health centers, and hospital systems, chronic disease organizations such as the National Kidney Foundation, American Heart Association, a number of food banks and pantries. As many of you know, they have their nutrition education piece, and the telehealth coaching program fits perfectly within their education structure. We work a lot with school districts and understanding their health needs, and working with them when we're creating their school health improvement plans, community health collaboratives, and lastly, our sorry for that formatting issue, but local governments and health departments. And so in the nutrition education piece, we're really able to then fit the nutrition piece within not just our telehealth coaching, but also our virtual exercise classes and also our virtual support groups. So with our telehealth coaching and with any of these services as well, we're able to use the evidence-based resources to support our participants. So looking at what is information that we can share from the CDC and from reliable sources. As we know, we live in the age of technology where everybody is getting information from all different social media platforms, and a lot of it is very much incorrect. So we want to make sure that our participants are receiving factual, evidence-based resources and information to make more informed decisions. Through our virtual exercise and nutrition classes, we give short 5 to 7 minute lessons at the end of a class. We follow that up with a challenge. So how are they using that information that we're now sharing, and challenge them to eat a new vegetable? What does that look like? Or participate in a separate activity that's associated with that challenge. And so then we're also using, because we are funded through SNAP Ed, we use many evidence-based SNAP Ed curricula like Create Healthier or Create Better Health or Food Hero. And so we're using that within our programs to ensure that the information we are providing to our participants is evidence-based. And then in a virtual support group, I think this is a a really, really great opportunity for folks to integrate themselves into that peer-to-peer support, and get an understanding of how others are practicing their healthy journey, right? And going through their course. And I think this is another way where health literacy is integrated, because then we're able to then hear from each person in how they're able to use health information and meet their goals. And so again, the connection to health literacy is vast. So our use of motivational interviewing, using plain and simple language for better understanding, the use of teachback in our telehealth coaching, and then support in finding evidence-based information for informed decision-making are really some of the top health literacy practices that we use within our direct service programming. And so just quickly, because I do want to be mindful of time and want to get to questions, just taking through a quick case study of a 40-year-old mother, somebody who has participated in telehealth coaching, and they were recently diagnosed as overweight and seeking weight loss for a healthy lifestyle. In their initial assessment, they walk 3 times a day, eat vegetables, fairly regularly, about 3 times a day, but frequently eat out during lunch. And so during the coaching they received is about one time a week for about 45 minutes over the phone. In these strategies used, we're creating SMART goals using motivational interviewing, using clear communication, teachback, and interactive tools as our methods of support for the participant. As a result, there was significant change behavior. At the end of the course of telehealth coaching, this person learned how to bring their own food to work and understanding nutrition labels. They decreased their portion sizes, and they were able to resist some food gifts and snacks at work while still understanding what moderation means. They increased their physical activity, and they were able to lose 3 pounds and gain confidence and better understanding of calorie intake and expenditure. And so some of the effective strategies here were, of course, integrating health literacy within coaching, motivational interview, and personalized literacy-sensitive health coaching. And so we'll continue coaching this person until they've reached what they see as their healthy weight and maintaining behaviors long-term. And with that, I want to pass it right back to Kara to talk a little bit more about your evaluations.
Yeah, thank you so much, Andrea. So that was just a short snapshot. I know we don't have a lot of time today, and happy to answer any questions or meet after this more about those programs. But I want to talk a little bit about evaluation, because we can't do programs without evaluations and ensuring the interventions are working. So we do track process and outcome measures. So those are listed here. I won't go into all of them, but I would mention that our outcome measures are collected at both a pre and post stage. And so post for us is after a participant has completed 3 sessions. So that's either 3 of the telehealth coaching sessions, our Stronger Texas classes, which are nutrition and physical activity, or the virtual support groups, which Andrea mentioned, which are brand new. So after somebody has received 3 of those group sessions, they'll be asked these same questions around self-efficacy, knowledge, and increased consumption of healthy things. So next slide. Awesome. So these are the results from this past year. We're actually still doing our surveying for this current year, and that'll end in August. We do this in partnership with UT School of Public Health, and that is through the statewide SNAP Ed program in Texas. So they aggregate all of this data up at a statewide level. So we're very fortunate to be a part of that and kind of test our intervention against the state. And so a few results to share from you of what happened last year. So we had statistically significant increases in the average number of cups of fruits consumed per day. So 0.9 to 1.1, statistically significant increase in the average number of cups of vegetables consumed per day. So that's in vegetables, 1.1 to 1.4. And then the other indicators were not statistically significant just because of the small sample size, but I did want to include them as well. Something that we have a huge barrier here, and many of you may also have this barrier, is getting people to complete pre and post surveys, particularly the post survey without incentives or multiple follow-ups. And so definitely open to any suggestions or ideas. But we did see increases across the board on all of the other indicators, including average number of days per week, fruits consumed, vegetables consumed, meeting guidelines for moderate or vigorous physical activity, and average minutes per week spent walking. So you can see some of those results as well. And just know that we're continually evaluating for this. And something this year we're looking into is actually asking specific questions around health literacy and measuring some of those things. But of course, we know these are really the outcomes of what we want from people increasing their health literacy around physical activity and nutrition. Next slide, Andrea.
So that brings us to our health literacy toolkit that we spent a really good amount of time really thinking through, being intentional and creating for organizations and collaboratives to really sit and think through their organizational health literacy. We wanted to be able to provide resources and information around how to assess their own health literacy and really think through what it means to support communities in increasing health literacy. So within the toolkit, you'll see information around certain practices that were discussed today. So motivational interviewing, clear, plain language, teach back, but then also organizations that are really doing the good work in enhancing health literacy here in the state of Texas, but also nationally. So we really invite you to visit our toolkit website on itstimetexas.org and download the toolkit for yourself and for your organization. And then that brings us to the end of our webinar. And we thank you all for joining us today in this webinar and understanding how It's Time Texas practices health literacy and works to increase health literacy in our communities. We do have a survey that we would love for you all to fill out, and this really helps to adapt our programming to ensure satisfaction to our audiences. And so we'll be sharing that link in the chat, and we'll also send it out along with this presentation in a follow-up email. We'd like to take a few minutes though to answer any questions that anybody has, whether you ask them in a chat or if you'd like to take yourself off mute and ask the question.
I have a question about your organization. How long have you all been in existence? And what percentage of your telehealth conferences involve nutrition actually?
Yeah, so I'll answer the first part of the question. So It's Time Texas, we are about to hit our 10 years as It's Time Texas. But there was an original version from our founder before that. But It's Time Texas, as it stands today, is celebrating 10 years, and our CEO is actually on the call. So I'm very excited to celebrate those 10 years together. And then Andrea, do you want to talk about the nutrition within telehealth coaching?
Yeah, I would say honestly a very high number, around 90% of our callers just this is what I was, because everybody has a goal around nutrition. And even when it has to do with physical activity, we want to insert some of that nutrition education into those calls because we know it's the pair in health behavior that we want to make sure a person understands. So there is always a level of nutrition education that goes into our telehealth coaching with our participants.
Thank you. Do you guys keep statistics on the level of diabetes increase in your area, your specific area?
Andrea, so she's asking if we keep statistics on so I think there's two kind of parts to that. Do
Yeah.
we collect that data? So I'll let Andrea answer that. But we look at regional data, yes, statewide, county level data on diabetes, prevention of diabetes. So that's definitely something that we're tracking that does inform the communities we focus on. It's Time Texas created an office in the Rio Grande Valley in 2016. It definitely was because of the landscape there and the high rates of things like diabetes, obesity, other chronic disease. And so we do concentrate our programming in those areas, but I'll let Andrea answer the question about what health information do we actually collect from participants.
Yes, and something to understand, everything is self-reported. So we don't have any business associate agreements with hospital systems or federally qualified health centers. And so what a participant provides the information, especially when at a chronic disease state, it is all self-reported. And so we do collect that information just to understand where a person's at, but it's not reported anywhere else. Like we don't report to anybody else on that information.
Thank you. I just want to add, the reason I asked that question is to see if you guys have determined what kind of impact you're having in your area. That's the reason for that question.
Yeah, no, I think that's a great question. And I'm the vice president of impact. And so those outcome indicators that I shared, those are short to medium term indicators that we're looking at. So things like increased fruit and vegetable consumption, increased moderate to vigorous physical activity, increased walking per week. Those are things that in the short and medium term we can look at over about a year. But really, those long-term indicators are what you're talking about more at a county or state level. Are we seeing obesity rates decrease? Are we seeing diabetes rates, other chronic related diseases? So we are taking a look at that. Those are very long-term. I think sometimes as researchers, as public health professionals, it's hard to connect that middle part where is your intervention contributing to those larger decreases? So it is a collective approach. And so that's why we do try to go into new communities and partner with existing programs because as a part of Texas SNAP Ed, we are trying to take a collective approach that all of these programs together are kind of impacting those broader public health indicators.
Thank you.
Great questions. Thank you so much for coming today.
I'm so happy to be here. When I saw nutrition, I had to be here.
I love it. I love your questions. Well, it looks like we're just about at time. So please connect with us. It's timestexas.org. Connect with us on social media. Andrea and I are very happy to meet with anyone one-on-one. Paige as well is here today, and we had a few other colleagues. But a huge thanks to SOPHE. We've had such a great year of getting to know them more and just look forward to further partnership. And I'm just really excited to have some more webinars on a few other different topics, including school health and recess policy, and then also our public health competition if you're a competitive person.
Thank you so much, Karen, Andrea, and Paige, for being here. We really appreciate all your insights. Thank you. Thanks everybody for joining us today. Our next webinar is July 26th. So look on our website for more information. Thank you.